in today's video, I will review the real examples of junior doctor CVs that have successfully led to doctor jobs here in Australia. This is in continuation to the previous video that I did for specialists and short-term training pathways. Who were the doctors? What were their credentials in terms of getting a job? Just like before, I'm going to divide this video into following section. What were the qualifications of these doctors like? What were their clinical experiences? What specialty were they working in back home, their own countries, whilst they were offered a job here in Australia? What were the CPD activities like? And had they got anything extra which might have helped them through the job? So Dr. number 1, or Dr. A, which we're going to call, who managed to get a job in Rockhampton, Queensland, qualifications MBBS in 2018, MD in General Medicine in 2022, Fellowship in 2D Echocardiography in 2023, AMC MCQ in 2025, and PTE English Test in 2025. Clinical experience 5 year plus since graduation from residency through consultant level internal medicine experience with roles in leadership, supervision, audit, and there are no career gaps. Now you may ask that why did I not recommend him to actually apply for the specialist pathway by through AMC MCQ pathway? He was actually short of number of years for the specialist pathway successful comparability application. He did so. I advise him not to launch the specialist pathway and do the AMC MCQ. Because of the excellent clinical experience, he managed to get a job right after AMC MCQ only. So currently he was working in general medicine, internal medicine in back home in India as a consultant. CPD over 25 short courses and workshops, including emergency focus AMC course. He's also done and completed ACLS course and surgery masterclass through us. In terms of his extras, he had research thesis as a part of his MD. He had done multiple clinical trials and also had a very strong teaching clinical experience. Dr. B, Melbourne Teaching Hospital, qualification wise MBBS in 2023, Bachelor of Psychology in 2019, AMC MCQ in 2024, PTE with a score of 80 in 2024. Clinical experience, 1 year of internship, postgraduate hospital rotations, all continuous with no gaps, and these rotations were in medicine, surgery, ONG, and pediatrics. CPD activities all up to date with BLS and ACLS certification. Excellent communication skills, and I think something to do with the psychology background degree, her communication. She was actually very calm. Dr. C managed to get a job in Townsville, Queensland. That's Townsville's hospital. Qualification, MBBS or primary medical qualification done in 2011. Graduate diploma in medical ultrasonography here in Australia in 2023. AMC MCQ passed in 2020, PTE passed in 2023. Clinical experience overall had nearly 13-year gap because had been working as a sonographer here in Australia in New South Wales. I actually met her at one of our workshops in Liverpool where she said that she wants to rejoin and come into the medical workflows. She was then advised by me to go back to China and do some recency. So she did the recency in general practice and RMO level medicine experience back home in China as a part of recency. Her CPT activities are all up to date with BLS and RSEGP as well as emergency focus courses. The in-person workshop at Liverpool Hospital, which was focused on the resuscitation and patient assessment and management skills. Extras, obviously her experience as a sonographer was very strong, and I think that might have helped her for that gap which she had over 13 years, but then it was the recency which helped her get back. She'd also did a lot of clinical observations both in New South Wales and in Queensland Hospital, and her final job, as I said, was in Queensland Hospital. Dr. D, John Hunter Hospital, New South Wales, qualification MBBS in 2019, PLAB 1, UK 2020, didn't manage to get a job after PLAB 1, so did AMC, which was completed in 2025, and English Test PTE completed in May 2025. Clinical experience is 5 years in total, which included internship, emergency and renal medicine rotation with full continuity without any gaps. Current specialty, working in renal medicine along with some internal medicine work, mixed. CPD all active, did AMC1 prep course with us, which is 80 hours CPD, BLS, ACLS and ATLS biostats workshop, and also had some conference attendances. In terms of extra, had a strong academic background, research certifications were there, and very good sound clinical teaching experience. So that could always help. Dr. E, Fiona Stanley Hospital in Western Australia, qualification MBBS in 2007, diploma in emergency medicine through RCGP UK in 2012, masters in emergency medicine in 2020, AMC MCQ 2024, and PTE was passed prior to that in 2023, and we had to redo the PTE exam. Clinical experience, over 18 years of total experience, 12 years plus in emergency medicine, including consultant level experience in leadership roles back home in India. Current specialty was working as an emergency medicine as a senior doctor. Wasn't quite a consultant back home in India, but as a senior doctor, but pretty much like a consultant. CPD, regular training of doctors and staff, and BLS, ACLS, which really showed a very strong commitment to the communication and leadership roles. He even authored emergency medicine articles and implemented clinical protocols and guidelines. Extras, obviously, all of that, leadership in teaching, running the department, clinical governance experience in emergency settings, all helped him get a job. Dr. F. Joondalup Hospital, Western Australia, MBBS in 2007, AMC MCQ in 2016, AMC Clinical in 2021, PTE in 2022, clinical experience 15 years total, India, Singapore, Maldives, a strong clinical experience in general medicine, ICU, geriatrics, and ophthalmology. Current specialty, she was working in general medicine and geriatric medicine. CPD, all active with BLS, ACLS, and first aid courses which were done through Singapore. Also had extras in terms of having governance experience and administrative experience in Singapore. Excellent multidisciplinary teamwork through various conferences, workshops, and also showing that in her CV. Conclusion, well, my conclusion is all of these CVs, there are 5 consistent themes which stand out. Number 1 is strong foundational qualification. AMC MCQ obviously is a must, but one doctor had actually completed AMC Clinical. Anybody who has got a large gap and has not been able to complete the recency, AMC Clinical really makes a very strong noise in terms of getting the job. So if you've got a clinical gap of more than 5 years or 6 years, AMC Clinical is going to really help you. But if you have got full clinical experience including critical care, emergency medicine, acute medicine, and surgery, then AMC MCQ may be just fine. But now with more competition, I would strongly advise for AMC Clinical. Active clinical continuity without any gaps, even those with gaps, with minimal gaps to even large gaps, by re-engaging in clinical work, managed to get the jobs. And this clinical work was, there was a temperament. They initially did observations or did the recency experience and then the observation, which showed that commitment of re-engaging or trying to come back to the clinical workforce. As I said, there was a doctor who was a sonographer, worked as a sonographer for nearly 7 or 8 years, then went back to China, did the medical work as an RMO, came back, did the observation, did the courses, and managed to find her job with AMC1 only. Defined specialty interest is not a very strong point, but I think having a hospital experience really helps when you're looking for a hospital job. These are all the doctors who have managed to get a junior doctor position in a hospital. And somebody always asks me that should I have a clinical experience in a GP clinic or in the hospital setting when I'm doing recency. I would also say prefer to have a hospital clinical experience in acute medicine, acute surgery. And I think most of these doctors, if you look at them, they have been working in acute medicine, surgery, obs and gynae, geriatrics, and so forth. CPD activity must be kept up to date with ACLS and BLS courses as a must. If you've done workshops in terms of procedural skills workshop, if you've done workshops in terms of any other resuscitation or critical care workshops, that obviously adds value. We've seen consistently in all their CVs, their CPD activities and courses were all up to date. Now, in terms of any extra contribution, we have seen is strong teaching, audits, research, publications, they all come to your help. I think it's those little bit extras which show that you have done something extra compared to the rest of your peers, and that pushes your CV up in the line. So my final message is persistence is really the key. I was talking to one of my colleagues who said to me that Dr. Rizwan, all of the doctors who have been working, these are all the doctors for the complete career guidance course that Dr. Simra and I run. And she said to me that all of these doctors, persistence has really been their key to success. So my take-home message for all of you who are applying for a job as a junior doctor, keep applying for jobs, keep doing the courses in terms of your CPD ranking up. Clinical observations are an absolute must. And most importantly, you have to really improve yourself with every unsuccessful interview. take up the feedback points, critical analysis, modify your CV, polish it. Think about the points which got you that unsuccessful interview, not being able to get you the job. What were the real cruel issues, and try and modify your answer for the next job. Now, Australian job market may get saturated, but the doctors who stay consistent always succeed. So do please apply for jobs right, left, and center. Don't make any compromises in here. Remember, all you need is those first 3 to 4 years towards the general registration, and from there the life becomes much more smoother. And whether you want to move into general practice or specialist training, it's all there for you. Now stay patient, stay active, and success is almost certainly guaranteed if you're up for it. Look after yourself and each other, and I'll catch you up in the next video. Goodbye.